Thank you, Madam Chairwoman. Mr. Red, would you agree that we will not be able to test nearly enough people without automated testing approved in our state laboratories?
I think that kind of testing is being done at the commercial scale. I'm not sure it's necessary in the public health scale side, and that's where these different roles that the two types of testing play.
So maybe I'm confused about something. My understanding is that automated testing needs to be approved by the CDC in conjunction with the FDA before it can occur in any laboratory, private or commercial or public.
There's a process of emergency use authorization, and that is an approval that the FDA grants to do a test that is earlier in development.
And you review it, though?
Well, we develop it. We basically...
So is it exponentially increases the number of tests that can be conducted in one day? It's significant. And we need for it to happen as quickly as possible. You would agree with that?
Right. I think that's right. I think whether we do that on the commercial side or in the public health side...
I don't care what laboratory is doing it. It's got to happen.
Exactly.
Has any laboratory in the country been approved for automated testing yet?
I can check on that. I can tell you that the LabCorp and Quest use those kind of systems, and they've been approved.
So is it happening anywhere in the country?
It's happening in those laboratories.
Okay, because it's not...
Let me verify that.
There's a difference between semi-automated, there's manual, semi, and then full automated. We have to get to fully automated, correct?
Let's check.
Because I can tell you not one laboratory in New York has been approved. Can I have your word here publicly that you will make this a top priority to get not just in New York, but as many laboratories across the country approved for this as quickly as possible?
I think we want the same end, which is to have really every person that needs to be tested be able to get that test done the day that they need it. And to that end, I think the exact means that you use to get there, I don't want to quibble about that.
But you do agree we can't get there without automated testing?
Some level of automation, certainly.
Some level. Okay, so thank you for that. I look forward to working with you and your team to get New York there as quickly as possible.
It's a high priority, and I think what's going on there is something that we're working very closely with the health department on.
Do you have any sense of a timeline for how quickly we can get to these automated testings approved in New York?
Well, I think that this is not a problem that we can test our way out of. I think that that's part of the overall strategy. We need to be testing so that we understand where we need to be intervening, and we understand the effectiveness of those interventions. So actually, I don't think for public health purposes, every single person doesn't need to be tested. For example, in the influenza pandemic 10 years ago, we weren't able to test everyone. We didn't need to test everyone. Our public health interventions were guided by the ability to extrapolate from the laboratory tests that we had.
Of course.
Different for clinical
Absolutely.
purposes.
Those who have symptoms, though. Those who are symptomatic should be able to be tested same day. And we can't do that without these testings. It's necessary. It's not sufficient.
Right, but especially for clinical purposes. The public health, doing a representative sample doesn't help you if you're the patient. And
Absolutely. So my apologies in advance that we're going to be contacting your office every single day until this happens in New York and across the country.